Well, in this week's Cardiology Countdown, we have a home-based program to improve symptoms in PAD, a biomarker-adjusted program for heart failure management, and a new treatment for DVT and pulmonary embolism with one of the new oral anticoagulants. So to begin with, we have a publication in JAMA of a so-called home-based walking exercise intervention for patients with PAD. This was a study of just under 200 patients at an institution where they actually had weekly visits to the hospital for, in the control group, just lectures about vascular disease. But in the active group, 45 minutes of a group walking session with instructions on how to do that at home. And it was found that that latter intervention program improved symptoms significantly, where the 6-minute walk test distance improved by from 350 up to 400 meters, and the walking time went from 8 up to 9.5 minutes, and all the other measures that they had that are standardized improved with that home-based walking program. And so this gives an alternative to what has not been reimbursed, I believe, in the United States, a so-called cardiac rehab for PAD. Did involve coming in for supervised group lessons, but one that could improve symptoms in PAD. The next up is the STOP-HF trial, also in JAMA, and this was a biomarker-adjusted management of heart failure patients. So it was a study of about 1,350 patients who were screened for heart failure, had some symptoms, using BNP. And in the intervention group, the BNP was assayed, and if elevated, in this case above 50, they were referred to a cardiologist and had an echocardiogram to help manage. And this group had a significant improvement in their management with better use of ACE inhibition. It was about 40% of the screened group ended up being biomarker positive for BNP. But they had a lower incidence of LV dysfunction or heart failure with an echo done in everybody at 6 months. And so the primary endpoint was significantly reduced, and the rate of heart failure was cut in half, from 2 down to 1% over a 6-month period. And also, interestingly, major adverse cardiac events were also reduced in this biomarker-referred, cardiologist-managed high-risk group. And so I think it's growing evidence for the usefulness of biomarkers to help triage patients. And the number one pick this week is the AMPLIFY trial that found a benefit of APIXABAN for use in acute PE or DVT treatment. This study was a very large trial, over 5,000 patients, that compared the use of APIXABAN versus the standard treatment of low molecular weight heparin followed by warfarin over a 6-month period for patients with acute PE. About a third of the patients, or acute DVT, 2/3 of the patients. There were over 5,000 patients randomized. And what was found was that the oral only with APIXABAN from the start had similar efficacy. It was 2.3 versus 2.7% for symptomatic recurrent VTE or death. And the hazard ratio was 0.84, a p-value for non-inferiority less than 0.001. Now, the big finding really was that the safety was dramatically improved, with 2/3 reduction in the risk of major bleeding. It went from 1.8 down to 0.6 for major bleeding, and major or clinically significant non-major went from 9.7 down to 4.3%. And so a new, simpler oral-only regimen that had significantly better safety for the management of acute DVT and PE. So for this week's Cardiology Countdown, I'm Chris Cannon.